But today we're taking a closer look at eating disorders affecting millions of Americans. The National Eating Disorders Association reports these illnesses have one of the highest mortality rates of any mental health disorder. And joining us now is Dr. Allison Chase, psychologist and eating disorder consultant at AK Chase Consulting. Thanks a lot for being with us once again. Appreciate it.
Well, thank you.
So let's start with the first question. I guess from a medical standpoint, what's happening in the body when someone is going through an eating disorder like this?
Well, it depends on the type of eating disorder, but very often there's restriction of nutrition. And whenever you have that and significant weight loss, your entire body can't possibly function, right? So what happens is your organs aren't working like they're supposed to.
Right.
Your brain doesn't have the nutrition it needs, and it causes a great impact. We have a lot of individuals talking about being cold all the time.
Yeah.
Their heart rate decreases because their heart can't work as hard because it's not nutritionally stable. So there are a number of physiological consequences, all of which are really dangerous.
Yeah, and also too, is there one trigger or different triggers that start, or that that starts an eating disorder?
And that is one of my favorite questions because I think it's a bit of a myth out there that there's one distinct cause to it, and that is not the case at all.
Okay.
What creates an eating disorder, referred to as the etiology of an eating disorder, is so complex. There's the biological, genetic, heritable factors involved, as well as this environment and world we live in, and all the things that go into that, right? Relationships, social media, all of the things.
Yeah.
And it's truly that combination of all of those factors that then leads to an eating disorder. There are often triggers that happen, whether they happen in life or, and that then often spurs on what has been kind of created. So there's often predispositions, and I point that out because it's a complex disorder.
Yeah, and how does that disorder affect our mental health, our brain, all that kind of thing? We talked about the other physical aspect.
Part. Yeah, well, it often runs hand in hand with different types of other mental health issues, anxiety, depression. You start to see mood shifts, which then result in behavior shifts, right? Sometimes it's withdrawing, sometimes it's acting a little bit like mood changes, behaviors from what individuals are doing. Is
there a way to stop it before it happens? Like you seem to go down that path, can you put a brake on it at that moment?
You can, you absolutely can, if it's caught in a way and treatment is sort of set up and sought out. And so, for instance, for kids in particular, this is where I'm always talking to parents about, if you notice anything, if you're noticing shifts in eating behavior, if you're noticing shifts in either body weight and size, any of their moods, like any of the things seem different to you, take it seriously. It's really important to be able to, go get some professional consultation, ask some questions, get it addressed.
How difficult is it to get over this?
It can be challenging in that, like I mentioned, it's such a complex disorder with the physical, medical pieces as well as the emotional, and it is very possible. So another myth that's out there that some people seem to keep holding on to, which is like eating disorders never go away.
Yeah.
That is not true. Recovery is absolutely possible. Now, it does require treatment, and it does require addressing it, and having the supports in your life help to do that, but recovery absolutely is possible.
Right, and we were talking about the physical aspects as well. Heart health.
Yes.
Tell me about that part.
Well, I mean, the bottom line is if that you are not feeding your heart with good nutrition to keep your body moving and doing that, of course it's a very big problem. And it can be a common sort of consequence throwing in with this eating disorder to do things like over-exercising to try to get rid of calories and things like that. And that becomes super dangerous if somebody is not getting in all the nutrition they need, and then they're overworking their body. So really, really important.
Really quickly too, are they getting younger?
I mean, we're seeing it very young, absolutely. I've seen younger patients exist for a number of years, and feel like I'm noticing we are seeing things even younger, particularly sort of in line with the fact that I think puberty is kind of happening earlier too, right? So again, another one of those risk factors.
All right, Dr. Chase, thanks so much for your
Thank
insight
you.
once again.
Thank
Appreciate
you so
it.
much.